broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. Today is April 29th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of DDA updates. Our presenters for today are Bernie Simons, the Deputy Secretary for DDA. We also have Bianca Renwick, the Acting Director for Central Region, Kim Gescheidel, the Director for Eastern Shore, and Onesta Duke, the Director for Southern Region, and Kathy Marshall, the Director for Western Region. We also have Carrie Zanchi, Consultant, Robert White, Director of Fiscal and Operations, Rhonda Workman for Director of Federal Programs, and Patricia Sestoki, Director of Programs. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and phone. And if you look at the panel interface on your right, labeled audio, you can click on either computer or phone to switch for the best option. There is a handout for this webinar, and you can find it in the handout section in the panel to your right. They can also be emailed upon request. We will be recording the webinar, and we will post this recording on the YouTube link on the DDA website. Questions can be typed in the question box or chat box in the webinar panel, and we will answer those towards the end of the presentation. So now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Good afternoon. And I want to thank everybody for being here with us today for our April 22 webinar. As you recall, we went on these on a monthly basis. So since our last webinar, we received a lot of inquiries around Appendix K, unwinding, what that landscape after Appendix K is going, what it looks like. And so we've decided today to spend the majority of the time on this webinar talking about those questions that have come in and providing guidance. And, you know, if we missed anything, you know, please feel free to ask at the end of the webinar, either clarification questions or something that may have been missed that we didn't come in the questions that we tried to answer, and getting into this Appendix K unwinding topic. So again, I want to thank everybody for your continued support during these webinars. They've been going on for a while now, since the pandemic started. And, you know, we need to stay in touch and be able to provide with you the most current information that we have at DDA and that we get from Medicaid and our federal partners with CMS, et cetera, about what we're doing. And again, our highest priority has always been the health and safety and well-being of the people that we provide supports to, their family, staff, all the providers. And again, I want to thank you for all of your feedback and everything you do. So let's go to the next slide, Donna. So before we get into the Appendix K unwinding, I just want to share a little bit about the update about the ARPA, which is the American Rescue Plan Act, and resources, which will benefit the whole DD community. And, you know, with the advocacy and support of the DD Coalition and specifically our Medicaid partners within the department, you know, we were pursuing an alternative path for the ARPA funds so that we could maximize and get as much money into the system and into the DDA community as possible. You're going to see in the following slides that there's basically two funding approaches. One, at one point we called it non-competitive grants and competitive grants. We are now calling it supplemental payments. And so in the work that we did with Medicaid and discussion with CMS, we learned that if we had grants and did the non-competitive grants, that they were not eligible for any federal matching funds. So that means we were not bringing in as much money into the state as we could, and then getting it out through supplemental payments is what the guidance that they were giving to us. So this methodology that we're doing for supplemental payments is basically remaining the same as we were doing for the grants. So that, you know, we will need to build out, you know, the criteria for the parameters and the tracking for these expenditures as we would have had it done with the grants. So this is pending CMS approval on this approach. We know that they've approved it in other states, and we'll be working with the providers on understanding these parameters and, getting support as needed to update your applications, etc. Specific to the competitive grants, now there is no match. So due to the inability of having that, the amount of the competitive grants is going to be about $4.5 million. And, again, we are working with our partners in the DD Coalition to develop recommendations and approach for this, and, how we can expand services and get innovative and, assist the DD community organizations in addition to our providers. So there are other organizations out there that may not be a direct support provider, i.e. residential, day, employment, etc., but are a community organization that we interface with. So, all right, next slide. So during the last month's webinar, I shared that we were going to get going on the National Core Indicators for Staff Stability Survey in 22, and I want to clarify some of that. So I want you to note that instead of completing 2 surveys, one for the National Core Indicators, we are only going to use that, and that will replace your current requirements under Maryland Health General Code, and you can see the code on there and the requirements under number 1 and number 2, and I'm not going to read that because it's right there. So again, this means that provider agencies must complete the NCI in order to fulfill your obligation under the Maryland Health General Code. And so that needs to be done by June 30th. And many of you already know Leslie, our Director of Provider Services, and her email is also on the slide. And remember that this is anonymous, but we need to get it in so we can take a look at all of the information. And our goal is, obviously, as your goal should be, 100%. Next slide. So, Appendix K. With the support of our Department of Health Secretary, Dennis Schrader, many of you know Dennis, and the Maryland Department of Disabilities with Secretary Beatty, and many of you know Carol Beatty, and other members of the DD Coalition, our Appendix K flexibilities were scheduled to terminate last month, March 30th. But now they're extended to June 30th of this year. And that means that individuals and families can continue to use the flexibilities that were in Appendix K, and start, please, planning for the transition for after Appendix K. And while this extension provides time and flexibilities, planning for transition is extremely important. And what is this going to look like? And I ask that the CCS and teams, including support brokers, the FMS agencies and providers, can help everybody understand what needs to be done as we move forward in scheduling needed staff trainings, specifically around self-directed forms for families, etc. And providers need to ensure that all their staff are meeting the requirements and qualifications that for CPR, first aid, etc. by or before June 30th. And so we can get that in, and obviously when the Appendix K ends, we need to be in a good spot. Next slide, please. So before I turn this over to my leadership within DDA, and they're going to talk about the Appendix K particulars, I want to recognize each of your contributions to our COVID-19 response. Individuals and families who guide our work every day in DDA, thank you for your resilience and flexibility and pushing forward to find new ways to provide supports, etc. We've got valued partners with CCSs. Remarkable efforts and advocacy have kept us going through the pandemic with your partnership, etc. And again, I also want to appreciate the contributions of individuals, families, providers, CCSs, and also my regional office staff, and who've worked very hard and very diligent during this time of the pandemic, and now working with everybody trying to look at where we are going next with the Appendix K ending. And I'm going to turn this over to my regional directors. As you heard, Donna will in the beginning introduce everybody who's going to be on this today. So again, I want to thank you for being here, participating, being with us. And now I'm going to turn this over to Kim Gashidle. Thanks, Kim.
Thank you, Bernie. Good afternoon. My name is Kim Gashidle, and I'm the Regional Eastern Shore Regional Director. I'm happy to be here today to share some resources and guidance for individuals and families about planning for the end of Appendix K and the flexibilities that have supported you through the pandemic. Like you, I know how important the Appendix K was in providing necessary supports during the pandemic, and now how important it is to work together to unwind these flexibilities and get back to the many areas of our lives that we've missed. This may sound like a lot of change, but the good news is that many of these flexibilities will continue through our federally approved waivers even after the end of Appendix K. And we are so appreciative of the work of our community partners, which was critical in developing guidance and forms to support these transitions. Next slide, please. And next slide, please. So, what does unwinding Appendix K mean, and what is important for me to know about this? So Appendix K is the approval from the Centers for Medicare and Medicaid to use a number of flexibilities that supported us during the COVID-19 pandemic. We learned a lot through these flexibilities, and because of that, many of them were included in the approved waiver amendment number 3. This means that some of these flexibilities will be continued rather than ending on June 30th, 2022. Understanding if the flexibilities you are using are continuing or ending is really important for planning your supports and any changes after June 30th, 2022. Your CCS and providers can help you understand these options, and there is a link for your reference as well. Some of the most critical areas that were handled by flexibilities were personal supports, community development services, and virtual supports that were able to be added under the Appendix K flexibilities to individuals' PCPs. So an example of a flexibility that will continue is virtual supports. During the public health emergency, meaningful day services like day habilitation and community development services could be provided virtually. This flexibility will be continued, and people will be able to receive a combination of both in-person and virtual supports after July 1st. An example of a flexibility that will not continue is the waiving of the training requirements for staff, such as CPR and first aid. During the public health emergency, both people self-directing their services and providers were able to hire staff immediately, even if they did not have the required training. This flexibility ends on June 30th, and all staff must meet all required trainings. So it is important for people self-directing their services and providers to take action now to assure all of their staff have the current training and certifications prior to July 1st. Next slide, please. What recommendations or advice do you have as I am thinking about the services that I or my family member will need after June 30th, 2022? Such an important question. Areas that might be important for you to consider as programs and services are reopening or increasing attendance include: what meaningful day activities and services were used prior to and during the pandemic that I would like to continue? What flexible weekly meaningful day schedule might work best for me? Did I benefit or enjoy receiving any of those supports virtually? And do I want to continue to receive some of my supports virtually? Next slide, please. I have hired family members, and this question comes up so frequently that I just want to go back and state it again. If I have hired family members as staff during the pandemic, what do I need to do before the end of Appendix K? You are self-directing your services and want to continue to employ your family members as staff after June 30th, 2022, as permitted under the program, you will need to be sure that they have all of their required trainings and also their family as staff form completed before June 30th, 2022. Training requirements for family members had been waived during Appendix K, so this planning is really important to ensure updated and current access for payment after June 30th, 2022. Participants can employ a relative after June 30th, 2022 for the following services only: community development services, ongoing job supports, follow along, nursing support services, personal supports, respite care services, support broker services, supported living, and transportation as permitted by the approved programs. And again, there is a reference link for you to access. Next slide, please. Do I need to update my PCP before June 30th, 2022 if I want to continue to employ family members hired during the pandemic? And so here the good news is no. The DDA has updated the family as staff form to identify family members. This can be used in place of a plan revision. This form and guidance can be accessed here at the link that you see on your screen. Annual PCPs due July 1st, 2022 and later must have the required form as well. Next slide, please. The regional offices remain committed to supporting all individuals, but we certainly recognize the unique challenges experienced by our transitioning youth, particularly during this pandemic period. What do I need to know or do if I am a transitioning youth on the autism waiver and I want to be considered for DDA services? So individuals who are transitioning youth eligible for July 2020, July 2021, and July 2022 have until June 30th, 2022. Again, that's June 30th, 2022, to complete and submit the DDA waiver application to be considered for DDA funding services. If you are TY eligible and have not completed the DDA waiver application process by June 30th, 2022, you will be placed on the DDA waiting list for services. For any questions or assistance, please reach out to your DDA regional office, the Transitioning Youth Lead staff. And again, there is a link provided for you. Next slide, please. So also regarding transitioning youth, what do I need to know or do if I'm a transitioning youth, but I am not on the autism waiver and I want to be considered for DDA services? Individuals who are TY eligible for July 2020, July 2021, and July 2022 have until June 30th, 2022 to complete and submit the DDA waiver application to be considered for DDA funding services. If you are TY eligible and you have not completed the DDA waiver application process by June 30th, 2022, you will be placed on the DDA waiting list for services. Again, for any questions or assistance, please reach out to your DDA regional office transitioning youth lead staff. And at this point, I will hand this over to Kathy Marshall, who will speak regarding transition to provider services. Thank you.
Thank you, Kim. Good afternoon. My name is Kathy Marshall, and I am the Western Maryland Regional Director. I'm going to share some of the common questions and Appendix K guidance to support our provider partners. Next slide, please. If a person does not want to return to in-person services after June the 30th, 2022, are they able to use virtual supports through the waiver as the sole method of service delivery? No, the DDA's Waiver Amendment number 3 specifies that virtual support cannot comprise the entirety of the service to promote community engagement and the goals of the HCBS settings final rule. The person-centered plan for each person should identify how they want to receive services, including the amount of virtual supports they prefer to complement in-person support provision. There is no set minimum amount of in-person services. Next slide, please. Post Appendix K, what is required for submitting or updating a program service plan or a PSP? Providers who are interested in continuing some or all of the retained service modalities permitted under Amendment number 3 must ensure that they have these approved by updating and submitting their PSP to the DDA provider services. These requests must be submitted before June 30th, 2022 in order to continue these after the Appendix K. The DDA remains committed to working with providers through this process for providers who submit by this due date. Examples of required PSP updates include shared or dedicated supports, virtual supports, and supports during an acute care hospital stay. To date, very few requests have been received, so it is important to restate this step and offer provider service teams as a resource to providers as needed. Providers can continue to provide virtual services as permitted by the waiver during the DDA review and approval process. Next slide, please. What happens after June 30th, 2022, when a person receiving residential supports also wants virtual day supports? Can they get 2 waiver services at the same time? Meaningful day service and residential dedicated supports cannot be provided at the same time. Waiver Amendment number 3 provides the use of dedicated supports, shared hours, or add-on hours prior to or after meaningful day virtual supports. If the use of dedicated supports, shared hours, or add-ons is not in a person's plan, these services do need to be included and approved by completing a revised person-centered plan. And there's a link on this slide for further information. Next slide, please. Is the flexibility for billing less than the minimum hours of meaningful day service for the full day continuing, or when will this end? The current emergency regulation in the Appendix K provides the authority for providers to deliver fewer than the minimum hours required for billing for meaningful day services. This flexibility, which requires a minimum of 3 hours as of April the 1st, 2022, will end on June 30th, 2022. Transition planning should be occurring to best support individuals. Many of our providers are calling this soft openings, and the soft openings may be anything from an individual receiving in-person supports a half a day, every other day, a couple days a week, or looking at supports and in-person supports to best support the individual. So I'm hoping that you're going to take this time to see what works for you. Next slide, please. Through a review and analysis of residential retainer days, as well as in response to provider requests for retainer days post-December 31, 2021, the Maryland Department of Health, MDH, is aligning the expiration date of residential retainer days consistent with the other flexibilities through June 30th, 2022. In addition, and to support individuals around resuming their desired time away with families and/or for vacation, MDH is seeking guidance from the United States Center for Medicare and Medicaid Services, CMS, to expand the definition of residential retainer days to include vacation days. Access to COVID residential retainer days in the PCIS2 system will be available through the use of both C days and V days to support billing specific to the type of absence effective January 1st, 2022. The delineation of absences, either by recording V days or C days, is important for potential reconciliation should the request to CMS for approval of vacation days not be approved. Please note, the established limits for a total of 60 residential retainer days during the Appendix K flexibility remain in effect, as well as the federal requirement associated with guardrails. All Appendix K guidance has been updated to reflect this date alignment, as well as the request to CMS for retroactive approval for use of retainer days to include vacation. You can see a summary of the information on this slide, and again at the bottom is a link that you can refer to. Thank you, and now my colleague Anesta Duke will cover common questions from coordinators of community services.
Thank you, Kathy. Good afternoon, everyone. My name is Anesta Duke, and I'm the Southern Maryland Regional Director. To our Coordinator of Community Services partners, much of the content shared today supports all of your coordination efforts, but these next few questions are areas where we have heard directly from you. Next slide. So one important question is, do all plans need to be revised to remove Appendix K flexibilities after they expire? And the answer is no. Appendix K flexibilities that will no longer apply should be removed in the next revised or annual person-centered plan, whichever occurs first, or if not already reflected. People self-directing and providers will not be able to pay or bill for Appendix K flexibilities that will no longer apply after June 30th of 2022. Person-centered plan updates should be prioritized for situations where there is a new health and safety assessed need for services, or when providers are being added to ensure authorization for these changes. Next slide. For individuals who want to continue with virtual supports as part of how they receive services after June 30th of 2022, is a full plan revision required? No. Individuals should be supported by confirming this interest, and this can be updated by the provider in the individual service implementation plan, or what we refer to as the SIP. During the annual person-centered plan process, this interest would be discussed and reflected in the plan, as well as the service implementation plan. Virtual supports are available to complement in-person supports, but cannot comprise the entirety of the service. Please keep in mind, as Kathy summarized earlier, in the provider section, that providers will need to update their program service plan to continue offering virtual supports if applicable. Next slide, please. So another important question is, to support reopening and transition planning, are full team meetings expected before June 30th of 2022? And no, unless there are significant changes anticipated. Through monthly monitoring visits and contact, individuals should be supported around how they are using various flexibilities that may be ending with the Appendix K. In addition, individuals should be supported around considerations for resuming services and programs that are reopening or for considering other interests. At this point, I'm going to turn this over to Bianca. Next slide, please.
Thank you, Onesta. Good afternoon, everyone. My name is Bianca Rennick, and I'm the Actin Central Maryland Regional Director. I'm going to share some updates about our Lts Maryland Transitions, as well as a few important updates. Next slide, please. Along with my regional director colleagues, we are very appreciative of the partnership and tremendous collaboration with our transitioning providers and our CCS agencies. The collective work for readiness and communication resulted in very successful transitions in April, and we are on track for the same in May and June. So you're asking, how many providers have or will be transitioning into Lts Maryland DDA module this spring? Right now, we have 11 providers transitioned in April. We have 6 providers scheduled for May and 5 providers in June. Providers from each region are represented in the transition. This represents approximately 3,000 people across 18 different services. Next slide, please. So, how is Mdh supporting providers through this transition? So the DDA is supporting pilot providers to transition their billing through a number of approaches. Starting with our regional office teams, we are working with those providers who expressed interest in pilot survey issued in January. Together, we have worked to assess provider readiness and their transition interests. In doing this, we considered a number of key areas. They included PCP readiness, IT integration, partnerships with CCSs, and overall staff training and preparedness for the fee-for-service billing and tracking. One of the helpful tools developed to support this process was the Lts Maryland DDA module playbook. The Lts Maryland playbook is a resource that helps providers consider the series of activities that must be completed prior to turning on service billing in Lts Maryland DDA module. This resource has been developed with the invaluable input, experiences, and recommendations of the DDA piloting providers and the early adopter group. You'll hear us refer to them often as the EAG. This playbook is meant as a guidance to support the process, but it is not a prescriptive one-size-fits-all approach. We have also revised and implemented a number of internal and external structures to further support provider and system readiness and strengthen the important feedback loops with our providers. We know these are big commitments of our providers and of our CCS agencies, and we value your interests and partnerships. A few examples of these structures include our Lts Maryland workstream with dedicated DD and MPS, that's our Medicaid Provider Services staff, to support provider and system readiness. Billing training for piloting providers. We have offered those in the spring, and they will continue to be offered between June and November. Additionally, to minimize any exceptions or delays in billings for those providers who have transitioned, there is an enhanced MPS and DDA team approach to resolving any issues that may arise once providers go live in Lts Maryland. Our Lts Operations Work Group is also another example that supports planning and discussion with stakeholders around what is working well and what can be improved. We also hold provider meetings weekly with our regional offices before, during, and following transitions. So let me restate that. We hold weekly meetings with our transitioning providers with the regional office before the transition, during the transition, and following the transition into the system. We are focused on continuous learning and sharing best practices through this transition process. One of our work streams, our Provider Readiness work stream, which will be led by the DDA Statewide Director of Provider Services, will be launching a Lunch and Learn series in late May. This will be an open and informal format for transitioning providers to discuss lessons learned and best practices, and will be a great opportunity for providers who are interested in transitions to learn from their peers. We will share the dates and time in the coming weeks. Next slide, please. Do residential providers need to, so we're continuing with our module transition update. So do residential providers need to document or validate the use of all residential shared hours in order to request and approve dedicated supports? No. Dedicated hours to support medical or behavioral support, needs or daytime residential support needs may be approved, utilized, and billed regardless of the use of shared hours in the home. Providers do not need to demonstrate the use of all residential shared hours to request dedicated supports, with the one exception of the dedicated supports for additional community integration supports, a non-clinical request. As you can see, we attached on here the residential service policy, which explains this. And so the new residential shared hours were developed with the goal of promoting access to flexible staffing, resources for individualized supports for community integration. The DDA recognizes that providers have unique business models and will staff each home in accordance with the individual resident needs and interests. It remains important to continue to use the person-centered planning process, and where dedicated support needs are identified, these can be requested in accordance with the established policies for dedicated supports. Next slide, please. I'm going to transition this back to Bernie to wrap us up.
Well, let me thank the regional directors for your thorough presentation, and we'll see what questions we get. But I just want to get into where we are with some numbers and boosters. And, you know, people have been very, very diligent and, you know, with clinics and partnership with pharmacies and local health departments, et cetera. So as of April 22nd, so this is about 7 days old, we've seen an increase in boosters since the last webinar at the end of March by about 482, which is good, and we hope people continue to get their boosters and get their second boosters. So the breakdown is noted, as you can see on the slide. And for some reason, providers are not reporting boosters as they have in the past. So I'm just going to ask everybody to please take a look at getting the information in to us so that we can, and work with your local health department so we can look at where we are with boosters. And we know you guys did an excellent job with people getting vaccinated, whether it be the 1 dose or the 1-2 dose, depending upon the medications, et cetera. So remember that your health department is a key partner for testing and PPE and supplies, and you know they're offering free N95 and KN95 masks, home kits, etc. So please contact your local health department, and again I'd ask you to please take a look at where we are with boosters. I mean, you did an excellent job with vaccinations, but you know we know that the numbers go up and they come down, and we just want to keep everybody as safe and protected as possible. Next slide, please. So this basically is talking about our upcoming webinars. If you could share that with your colleagues, families, participants, and please recognize that as you have with this, when you register for a webinar, you receive a confirmation and information about joining. And again, I want to thank everybody for attending today's webinar and posting your questions in the chat question box. And again, we value, or I value all of that feedback, because it helps us, move forward and meet people's questions and concerns and how we move forward together within, our individuals, families, providers, regional offices, DDA headquarters, etc. So again, we're going to wrap this up and go into questions, but please stay healthy. And again, thank you for your dedication to the DD community. And if I don't get an opportunity to close out based upon time, the amount of questions, please have a wonderful weekend. Thank you.
Thank you, Bernie. We're now going to go to questions. But before I start with questions, I wanted to start with a comment in the chat box. And it says, thanks to the regional offices so much for the weekly meetings to work towards transition to LTSS. That has been so helpful. Exclamation, exclamation, exclamation. So I think I just wanted to say that because it's just really wonderful to get that kind of feedback from team members and providers. So thank you so much. So I'm going to start with Kim. I have a question for you in the chat box. And it says, if I'm a provider and hire a family member to work with participants during the Appendix K, can they remain employed after June 30th?
Thank you for that question, Patricia. And, this was one of the really great opportunities through the Appendix K to be able to hire family members to work with folks. And yes, this is something that it has been included and extended, so they can remain employed after June 30th. But remember, they need to get all of the required trainings completed by June 30th in order to remain as an employee.
Great, thank you, Kim. Robert, I have a question specific to you, and it's written as this. I believe it said 4 days couldn't be used until 60 days after ending of the public health emergency. Due to Appendix K extending, does this mean September due to Appendix K extending to 6/30?
Thank you, Patricia, and that's a great question. What I'd like to do is confer with our Medicaid colleagues just to make sure we're on the same page, and then we'll update our FAQs with the answer.
Great, thank you, Robert. I have a question specifically is a question about behavior supports, and this one is about how can CCSs get assistance when they're trying to identify a behavior supports vendor or provider for people in self-direction. And so, Rhonda, would you like to take that one?
Sure, absolutely, Patricia, thank you. Is under self-direction, behavior support services is a service that we have budget authority for. And what that means is that people self-directing can access the DDA certified behavior support service providers, and that information can be provided by your regional office, the list of behavior support service vendors.
Thank you, Rhonda. And this one's specific, Robert, to you, and it has to do with rehabilitation. It says, can they have providers bill for retainer days retroactive to January 2022? If so, will PCIS2 allow us to do this?
Yes, PCIS2 has been updated to reflect the extension of the Appendix K flexibilities. If anyone is encountering an issue with that, please send me an email directly and I can research it. But it has been configured to allow for that.
Thank you, Robert. And this one is specific, Rhonda, to some of the Appendix K. Are there any updates on the limitations around the virtual services that will be available after the end of Appendix K? For example, if there is a minimum or maximum number of hours or days per week that participants can choose to engage in virtual supports. I know Kathy talked about this in her slides. So I don't know, Kathy, do you want to add anything to that before we flip it over to Rhonda?
There is no minimum set.
Okay, thank you. Any additions, Rhonda?
Yeah, I would just say that, you know, as Kathy said, we have not established a minimum or a maximum number. Really, we're looking for the person-centered planning process for the team to come together to look at what will work for individuals. But again, the requirement is that virtual supports cannot encompass the entirety of the service.
Thank you. And I see I have other questions. This one is about if a participant wants her family to continue as staff after June 30th, is it correct that the participant must switch to self-directed waiver services? Rhonda, you want to answer that one?
Sure. The answer to that is no. Just as Kim has shared with us that, you know, providers can hire family members on and they can continue to provide services. All family members that have hired and all staff that have been hired during the Appendix K timeframe will need to have all those training and certifications updated by June 30th. But no, if you are receiving services from a family member under the traditional model, the provider can continue to employ that one based on relatives that can provide services as noted in the programs.
Thank you. And Robert, this one's for you. Do the retainer day guardrails still apply after June 30th?
No, the federal guardrails that pertain to the use of the Appendix K flexibilities would end at the same time that the Appendix K flexibilities came to an end.
Okay. And the next one is more of a clarification. And I'm going to ask Kim if you could answer on this and then piggyback on any of us if we need additional. But please clarify on family as volunteer staff. Can family be a staff volunteer after June 30th, 2020?
Patricia, before we answer, just some clarity. The fact that it ends does not mean that when we do the look back, the audit, those guardrails will still apply to that period, that Appendix K period.
A good
just
point.
Wanted to make sure that you know, that it just doesn't go poof and go away. It will still apply during the audit of the Appendix K flexibilities.
Thanks, Robert. Great point. So Kim, this one is a clarification. Please clarify on family as volunteer staff. Can family be a staff volunteer after June 30th, 2022?
So I'm not sure I'm clear on the staff volunteer role. It seems to me you're either a staff person or you're a volunteer. Volunteer, I would think, could continue, but you know, as a staff person, if you're speaking on that regard, then you would need to assure that all of the trainings and certifications have been completed by June 30th.
Thank you, Kim. And then the next one is, so in July 2022, will individuals have 18 days to be paid when they are not in residential services? So this is about the retainer days. So Robert, you want to answer this one?
Sure, Patricia, could you repeat the question, please?
Sure. So in July 2022, will individuals have 18 days to be paid when they are not in residential services?
Okay, great, thank you. So there's been several questions related to the use of Appendix K, especially once the extension comes to an end. And again, I would need to confer with our Medicaid colleagues and then revert with the answer when we update our FAQs.
Robert, I can add a little bit. I think what they're referring to is in the waiver program, absent the public health emergency, our residential retainer fees were changed from 30 to 18 days. And so once the public health emergency and we unwind these flexibilities, those 60 residential retainer days would then revert back to the 18 days based on a calendar year.
Okay, thank you, Rhonda. The next one is, has the DDA rent subsidy webinar been rescheduled? Does this program launch on May 1st? Great question. Yes, this program does launch over the weekend on Sunday, and we have been posting the webinars on our website. They're specific to families, participants, providers, and also CCSs. So if you need additional information, please reach out to our Director of Innovation, Stephanie Jones, or myself, and we're happy to provide you with additional guidance in support of where you can get that information. This one is for Onesta specifically. Any idea of any of the services, for example, comprehensive assessment after June 30th?
I'm sorry, Patricia, can you repeat that?
Sure. It says, any idea of any of the services, for example, comprehensive assessment after June 30th? So probably need a little more clarification.
Yeah.
I think this is in continuation to the virtual supports for CCSs. They want to know if they can continue this after June 30th. So
in reference to the actual comprehensive assessments, if they can continue to do it virtually,
yes,
it's just not
correct.
Clear. It's my understanding that
it's a no.
Okay. Okay. Thank you, Patricia.
No worries, no worries. We're all together, and we will provide additional support and guidance to the CCS entities as to what happens after the public health emergency when it comes to comprehensive assessments and some of the things that we're doing with case management. So appreciate that. Let's see, there is one right here, some other ones. Some folks are asking, this question was in 3 parts, so I'm just looking to see. So will there be consideration of allowing virtual supports for ISS participants after Appendix K ends? Rhonda, do you want to answer that?
Patricia, can you ask that again? I was reading some of the questions.
Sure. Will there be a consideration of allowing virtual supports for ISS participants after Appendix K ends? So you want to talk about the ISS and how it's ISS versus waiver versus Appendix K?
Right. I believe that virtual supports would be available for all our programs, but again, we'll take that back and look at that a little bit further.
Okay, great. All right, and then I'm getting to a couple of last questions here. So this was more of a clarification. I'm going to read it a little slow for folks. So it sounds like DDA is saying that family members can serve as direct support professionals in all situations after 6/30/22. Regarding the rules, though, is that family members can only do this for personal supports in supported living if some exceptions are met. I don't believe family members can provide community living group home services after 6/30. Is that right? So there's 2 questions here, and I want to make sure that there's very clear clarifications of what people who are in self-direction, their higher staff, family members as staff, and then there's a question about if you're a provider and you hire family members as staff. So Rhonda, can you talk a bit about those 2 things?
Sure, absolutely. It's a really good question. And in our waiver programs, we have information related to the scope of the services and the qualifications. And in the programs, relatives can be hired as staff for community development services, employment services, meaning our ongoing job supports and fall-along, nursing support services due to extraordinary situations, personal supports, respite care, support broker, supported living, as noted in the waiver for a sibling, and also transportation. So again, it's very specific to the specific services that are outlined, and it includes more than the personal supports and supported living.
Okay, thank you, Rhonda. I don't see any more questions in the chat that I haven't read, but Carrie and Rhonda, can you just make sure I didn't miss any questions? Yeah, I think we've answered all the questions in the chat box. I'm just going through to make sure that nothing has come in since the last one. Oh, here's a question that just came in. Currently, our agency is requiring visitors to be fully vaccinated to visit our homes. A good number of CCSs are not vaccinated. Will the unvaccinated CCSs be approved to do virtual visits? And if not, suggestions how to safely complete the visits? That's a really good question. I think, one of the things we want to do is how do we practice public health and keep everyone safe? And, we can't ask people whether they've been vaccinated or not. So that universal safety precautions needs to be used. But we really do want the CCSs to have that face-to-face and ongoing interactions with the participants, not only to complete and facilitate the person-centered plans, but also to conduct the quarterly monitoring visits that they have to do every quarter. More questions are coming in as I'm talking. So has DDA changed the requirements for DSP wearing masks? This is really a individual agency requirement. We want folks to follow the CDC guidelines, and then also specifically what you're doing. Again, our number one priority is the safety of not only our participants, but also families and the direct support professionals and our providers alike. Okay, I don't have any additional questions in here that, so I will gonna go ahead and see if there's anything else that you guys would like to, Robert, is there anything else that you'd like to add specifically to Appendix K or any information that we share from the slides?
No, not at this time, Patricia, but I do see a question regarding boosters that came in, and whether or not folks with IDD under 50 are eligible for a second one. If someone wants to take that.
Yeah, that's the one we would follow. I think right now, follow what the guidance says about vulnerable or compromised immune system. And I don't think it has whether a person has a disability or not. It's just looking at the compromises of people's immune system and whether they should have the booster. We are encouraging everyone to get the vaccine first, second, and the 2 boosters. All right, I am going to, we have a minute left. Bernie, I know I want like to close us out.
Well, again, I want to thank everybody for attending today and for your thoughtful questions. And, we will hope everybody has a safe, quiet weekend. And hopefully the sun stays out the way it is this afternoon. And everybody, again, have a good weekend and thank you for being here.